Hello, welcome to this lesson. Today's topic is HIV and AIDS. Yes, we're talking about HIV and AIDS. What is HIV? What does HIV stand for? HIV is human immunodeficiency virus. Yes, it's a virus. It is one of the deadly diseases that is spreading across the nations of the earth. So, what does the H human stand for? It is means it is transmitted between human beings. This virus is transmitted between human beings and not between animals and humans. Then also, when we say immunodeficiency, we are talking about it means it breaks down the immune system. This means that the body cannot protect itself from or against diseases. So that's what immunodeficiency means. Then virus is a microscopic organism that causes diseases in one's body. So that is a virus. So this is what HIV means. Now you need to understand that a person with this infection is known as being HIV positive. So when yes somebody says HIV positive, it means that the person have this disease, this virus in their bodies, in their system. All right, so what then is AIDS? AIDS stands for acquired immune deficiency syndrome. Acquired immune deficiency syndrome. Now, when we say acquired, we mean that the disease is not hereditary. That means it's not passed from one parent to the children, no, or one generation to another, no, in the family. It means it's a disease that is not hereditary but developed from contact with a disease causing agent. A disease causing agent means one that is already infected with this virus or disease. Then we say immune, like we said, we talked earlier, we said this means that the disease causes a weakening of the immune system. The immune system is that what helps to fight diseases or wanted viral and bacteria in the human body. Then what then is syndrome? Syndrome is a collection of symptoms and signs. So the collection of symptoms and signs is what we refer to as syndrome. Now, there are difference between HIV and AIDS. They are not the same. They are different. Now, one difference is HIV means human immunodeficiency virus, while AIDS stands for acquired immunodeficiency syndrome. That's one difference. Then another difference is HIV is a virus causing AIDS. So HIV is what brings about AIDS. Well, why AIDS is the disease caused by HIV. All right, so the next, HIV attacks the immune system. Yes, the HIV virus attack the immune system. Why AIDS is why AIDS is when the immune system is totally broken down. So you see, HIV attack the immune system, then it leads to AIDS, and AIDS is when the immune system is totally destroyed, broken down. That is AIDS. Another one is when a person is attacked by HIV, he or she does not show sign of ill health. Yeah, when someone has contracted the HIV, the virus, the person will not show any sign of sickness. But when a person has AIDS, he or she will definitely show signs of ill health, sickness. Then the last one I'll give you here is all persons living with AIDS are infected with HIV. But not all person with HIV infection has AIDS. So it is possible to have for someone to be infected with HIV and not have AIDS. But it's not possible for someone to be infected with AIDS and not have what HIV, because HIV brings about AIDS. Okay, so let's go to another part of this lesson. The mode of transmission. How is this disease transmitted? HIV has specific transmission pattern. The main modes of HIV transmissions are number one, unprotected sexual intercourse with an infected partner. Yeah, yes, when the person sleeps with and has sexual intercourse with an infected person, the person can contract that disease. Then another is transfusion of contaminated or infected blood. When someone maybe had an accident or a shot of blood and they have to give the person some blood. If the blood is infected or contaminated with this virus, the person or the patient will definitely be affected too. Then also the use or sharing of contaminated sharp objects such as injections, needles, blades, knives, and many others. If that object has been contaminated, it can become a mode of transmission. Then lastly, from an infected mother to her child, a pregnant woman can that is infected with this virus can pass it on to her child in the womb during pregnancy, birth, delivering, and even through breastfeeding. So you see, a mother, a woman who has the virus and she's pregnant can also infect that child. Now, you need to know that HIV cannot be transmitted through some other means. Now, let's look at some of those means that HIV cannot be transmitted. Number one, casual contacts, such as hugging and shaking of hands. Now, if you hug someone who is infected, you will not become infected. No. So when you shake someone that is infected or hug them, you will not contract this disease. Then sharing of toilet seats. Yeah, sharing of toilet seats, you cannot HIV cannot be transmitted through that. Then sharing of clothes, no, HIV cannot be transmitted through sharing of clothes. So if you take a clothes that has been put on worn by an infected person, definitely you won't contract that disease. Then sharing eating utensils such as plates, cups, or pots. Sharing it with an infected person will not make you contract that disease. Then mosquito bites or bites from bed bugs, it's not possible. These insects cannot transmit HIV HIV disease. No. All right. So there are symptoms and signs of of AIDS. What are those signs and symptoms of AIDS? You need to know that it is divided into two. We have the major signs and the minor signs. Let's start with the major signs. Major signs that someone has AIDS is number one, persistent fever of more than 1 month. The person can be so sick for a month plus. So that is a major sign. Then another, unexplained weight loss. Yes, that person begin to lose weight, lose 10% weight from normal weight that a person should have. Then lastly, a person will have chronic diarrhea for more than 1 month. Wow. So you see, these are major signs. Then we have the minor signs. So these minor signs can also, when you see the signs, it can detect or could know that the person has been infected. Number one sign is persistent coughing. Yeah, when the person is coughing consistently, non-stop. Then also itching skin diseases. Yeah, the person is experiencing so many itching skin diseases. Then nervous damage. The nervous system has been infected. The person can also have anemia. Then also loss of memory, difficulty in swallowing. Yes, the person may have injuries in the mouth and in the throat. So these are minor signs and symptoms of AIDS. All right, so lastly, in this lesson, we'll look at the prevention of HIV and AIDS. Now, number one prevention I'll be teaching you is abstinence from all forms of sexual intercourse. Yes, all forms of sexual intercourse, especially if the person is infected with this virus, you can contract it when you get involved in sexual intercourse. Then also, prompt and complete treatment of sexually transmitted infections. Yeah, there are some infections that are being transmitted through sex. Now, the person needs to treat it quickly to prevent it from becoming something severe. Then the next is do not allow pressure group, peer pressures to force you into unsafe sex activities. Yes, there's peer pressure. So don't be moved by peer pressure and that wants to force you into unsafe sex activities. No. Then another important prevention is public enlightenment and mass campaign rally. Yes, public enlightenment. We need to inform the public, have rally, and let them know about this virus, this disease, and how to prevent and teach them about the mode of transmission and all that. So this way will help prevent the spread of HIV and AIDS. Then lastly, verifying that any needle or syringe or any piercing instrument or equipment is sterilized before use. Yes, you must sterilize. To sterilize means is to make sure it is safe, clean for use so that you don't contract this disease. So these are the lessons we'll be getting from this topic, HIV and AIDS.